Every year, right as the heavy rains hit the streets of Nallakunta, Hyderabad, local dental clinics see something totally bizarre. They get a massive spike in patients coming in with swollen, bleeding, or just extremely painful gums. And honestly, here's the kicker, most of these people are genuinely shocked. They brush twice a day, they take care of their teeth, and they really think they're doing everything perfectly right. Yet, the second the monsoon starts, their gums start sending out major distress signals. So what exactly is happening? Today we're going to unpack the source material from Apollo Dental Nallakunta to uncover why the rainy season silently attacks your gum health and exactly what you need to do to protect your smile.
Here is our roadmap for this explainer. We're going to break down the monsoon problem, decode those early warning signs, identify who is the most vulnerable, explore some modern clinical treatments, and wrap up with a daily prevention routine you can actually start tonight.
All right, Section 1, the monsoon problem. Let's look at how the wet season literally creates a bacterial paradise right inside your mouth.
It's the ultimate frustrating question, isn't it? Why do perfectly healthy gums suddenly act up when the weather changes? You haven't changed your toothpaste, you definitely haven't stopped brushing, but suddenly the sink is pink when you spit. Well, what we're learning is that during the monsoon, brushing alone just isn't always enough to combat the shift in the climate. It's basically a perfect storm, and the formula goes like this. First, between July and September, humidity in Hyderabad hits 85 to 90%. In this warm, super damp environment, anaerobic bacteria, that's the specific type that destroys gum tissue, multiply 3 to 4 times faster than usual. Crazy, right? Second, your immune system is totally distracted fighting off seasonal colds and viral fevers, which means your gums lose their natural defensive shield. Third, our diets totally shift. We crave hot, sugary chai and starchy fried street foods. That stuff perfectly coats the gum line with bacterial fuel. And finally, when you get congested from a cold, you breathe through your mouth. This dries out your saliva, which is your body's built-in antibacterial rinse. Less saliva equals way more bacteria, which equals instant gum irritation.
Moving on to Section 2, stages and symptoms. Because when it comes to decoding the warning signs of gum health, time is absolutely your most critical factor.
You really need to treat these specific symptoms as your own direct personal diagnostic checklist. It is so easy to brush them off as just a minor irritation, but they are literally your gum tissue sending out an SOS. Bleeding when brushing, even if you're doing it gently, is never normal. If you have persistent bad breath that comes right back an hour after brushing, gums that look dark red or actually feel warm, new spaces opening up between your teeth, or visible pus, you have a problem. If you're ticking 3 or more of these boxes right now, you need to pay very close attention to this next point.
Okay, so the crucial point here is understanding the timeline of the infection. If you catch this at the gingivitis stage, where your gums are just red, puffy, and bleeding, it is fully 100% reversible with a professional cleaning. But if you ignore it, it progresses into periodontitis. At this stage, deep pockets form below the gum line and your actual jawbone starts to deteriorate. Periodontitis is a life sentence. It's manageable, but it's not curable. And if it escalates all the way to an abscess, you are looking at severe pain and the need for immediate clinical drainage. The window to reverse this damage without surgery is open right now, but it definitely won't stay open forever.
And this bacterial invasion goes way beyond just losing a tooth. Inflamed gum tissue actually has a compromised physical barrier, which basically gives those multiplying monsoon bacteria a VIP pass directly into your bloodstream. Research confirms that untreated gum disease acts as a dangerous gateway to severe systemic issues. It increases cardiovascular risk because those bacteria trigger arterial inflammation. It makes blood sugar incredibly difficult to manage for diabetics. In pregnant women, it's actually linked to a higher risk of preterm delivery. And during monsoon season, those mouth bacteria can literally be aspirated into your lungs, making respiratory infections so much worse.
Section 3, high-risk groups. Are you, or maybe someone you love, especially vulnerable this season?
While the monsoon weather affects everyone, these specific groups get hit the absolute hardest. Diabetics have weakened gum immunity due to high blood sugar. Pregnant women experience hormonal changes that make their gums hyperreactive to bacteria. In fact, pregnancy gingivitis is a very real, clinically documented condition. Smokers are at a massive risk because tobacco not only suppresses immunity, but also constricts blood vessels. This is sneaky because it actually masks the early bleeding signs until the infection is severe. Teenagers with braces have hardware that traps plaque in the humid weather. People on blood pressure or antidepressant medications often experience gum overgrowth, which just creates deeper pockets for bacteria to hide in. And lastly, if you skipped your last 6-month dental visit, well, those monsoon bacteria are going to have a field day with the tartar already sitting on your teeth. All right, Section 4, modern treatments.
The good news is that we have clear, highly effective solutions right in the neighborhood at Apollo Dental Nallakunta.
The treatment starts by completely removing the guesswork. Step 1 isn't just someone poking around in your mouth with a little mirror. It's a comprehensive periodontal evaluation. Specialists take precise pocket depth measurements to see exactly how far the bacteria have invaded. They use digital X-rays to check the bone levels hidden beneath the gum line. And honestly, the coolest part is the intraoral camera walkthrough. They put a tiny camera in your mouth and show the live feed on a screen, so you see exactly what the dentist sees. It totally empowers you to understand your own health.
Now, when we compare traditional methods with modern tech, the difference is just staggering. Traditional deep cleaning or scaling is great, but when you add BIOLASE laser bacterial reduction or LBR, it's a real game changer. With scaling alone, healing takes about 7 to 10 days with moderate soreness. But with laser treatment, that focused light energy precisely blasts away the bacteria hiding in deep pockets without cutting any healthy tissue. The result? Healing time is slashed to just 3 to 5 days, soreness is practically zero, and because it actually stimulates tissue regeneration, the chance of reinfection drops significantly.
For most patients, that non-surgical combo of scaling and laser is the whole shebang, often done in just 1 or 2 visits. But if things have progressed, the clinic steps up the protocol. Step 2 involves targeted antibiotic therapy. We're not talking about a random broad-spectrum pill, but specific meds for specific confirmed infections. And finally, if the infection has severely degraded the bone, they perform periodontal flap surgery. Now, don't let the word surgery freak you out. It is done entirely under local anesthesia, so you remain completely comfortable while the specialist cleans out those really deep bone-level pockets.
Finally, Section 5, Daily Prevention. Here is your everyday Monsoon care checklist to protect your smile at home.
Your daily routine needs a slight upgrade for the rainy season. You need to brush for a full 2 minutes at a 45-degree angle to the gum line. And flossing? Absolutely non-negotiable right now, because that tight space between your teeth is exactly where Monsoon bacteria are the most aggressive. You'll also want to add a chlorhexidine-based antibacterial mouthwash to your daily mix. Make sure you drink lots of safe, filtered water to keep your natural saliva flowing. And here is a crazy fact. You need to change your toothbrush every 3 months, especially now. The damp air in a monsoon bathroom actually causes fungal growth directly on your toothbrush bristles. Yuck!
You also need to make a few quick lifestyle tweaks. If you do indulge in that sugary monsoon chai or some fried street food, go rinse your mouth out with water immediately afterward to wash away all that starch. You can actually strengthen your gum tissue from the inside out by eating vitamin C-rich foods like amla and guava. If you catch a nasty seasonal flu and brushing physically hurts, switch heavily to mouth rinses for a few days. And if your doctor puts you on antibiotics for a monsoon fever, definitely make sure you take a probiotic to protect the good bacteria in your oral microbiome.
And if you do need professional help, our source material highlights exactly why local residents rely on Apollo Dental Nallakunta over on Shivam Road. They aren't just a generic clinic. They have a dedicated periodontist, a true gum specialist on staff. They follow incredibly strict sterilization protocols, which is absolutely vital when cross-infection risks skyrocket in all this humidity. They even offer late evening slots between 6 and 8 p.m. for folks who work all day, and they provide flexible EMI payment plans, so there is literally no financial reason to delay getting the treatment you need. I want to leave you with this final, really powerful thought from the clinic. Damage accumulates silently. The monsoon is tough on Nallakunta's roads, it's tough on its roofs, and it is brutally tough on your gums. Your gums are the literal foundation of your entire smile. So ask yourself, are you going to wait until a reversible irritation silently dissolves your jawbone, or will you take control before the next heavy rain falls? Thanks for joining me on this explainer, and stay healthy out there.